came to me last year and she was absolutely terrified of getting pregnant again because she'd had this traumatic experience. But at the same time, she desperately wanted to have a VBAC, ideally a home birth. Now, here's the thing you need to know about Claire is she was a type 1 diabetic. So this already was odds stacked against her. But in the end, what she ended up accomplishing is just no short of transformational. She had a home birth after cesarean with an 11-pound baby. So Claire, thank you so much for coming on today. And can you just tell me a little bit about where you were at in your first birth, what led up to that disappointing cesarean, and what led you to decide you wanted to try again?
Yeah. Well, thanks for having me. I'm so excited to talk to you. I joined your Facebook group when I was actually, I think when I was had just had my C-section, maybe with my first. I think I had already had him when I joined your group. And yeah, the first go around, like as you said, I have type 1 diabetes. So pregnancy automatically is really medicalized in the type 1. Like if you have type 1 diabetes, you're categorized as high risk. And I didn't realize that, like I didn't know that. And I remember going to my first OB appointment, and I have like very well controlled diabetes. I have like a non-diabetic range of blood sugars typically. And still, even with that range, I remember going to my first appointment and they were like, this is the scariest appointment because we're going to tell you everything that could go wrong. And the diabetes educator even said, so after hearing this, if you want to terminate your pregnancy and try again, that would be okay. And like immediately, I was just like completely turned off of that system. And my first thought was like, well, I think I'm just going to find a different OB office because I like home birth wasn't really in my like brain yet. But then like as I started looking, I realized that like you get so pigeonholed if you have type 1 diabetes. So like there really weren't any other options. And basically it was like OB care, high risk OB care, or home birth, possibly unassisted, because many midwives won't even take type 1s. And this was like, when I first started researching it was like way out there for me. Like I was like, I remember the first time someone suggested home birth, I was like, no. And then like the more research I did and the more I started to understand the medical model of pregnancy and all of this, I started being like, yes, home birth, like that is actually what I want. And I talked to, in my first birth, just about every midwife in Washington State where I live. And I found 2 that were willing to take a type 1 diabetic client with the understanding that like they weren't managing diabetes at all, like just the pregnancy. And I decided on one of them, and we kind of together, I decided that I would do concurrent care. And it turns out, like, as you'll see, this midwife who I like absolutely love, she is really like, she's a very traditional midwife, and probably she would have been like, you can do whatever you want. But I kind of felt like I wanted to have that concurrent care of OB care and midwife care, but it ended up being a really bad decision. So I had the midwife in my ear, who's like the most chill person, being like, you're so healthy, everything's good, like no, like don't worry about anything. And then I had the OB MFM, like high risk OB in my ear, being like, everything's going to go wrong. You can't do this by yourself. We're going to induce you at 37 weeks, like all this stuff that they like to do for type 1 diabetics. I have literally, I actually like went through and looked at them the other day because I wanted to be able to tell you. I think I have about 75 printed ultrasound photos from like various ultrasounds that I had with my first. Isn't that insane?
Wow.
Yeah. Because I had ultrasounds every 2 weeks with him. So fast forward towards the end of my pregnancy, my midwife continued to just like be really encouraging and wonderful. And my OB continued to be like, you need to be induced by 37 weeks. And I think because I had those 2 voices, I opted to do some like, I asked my midwife if we could do some like natural induction techniques. And I'm doing, if people are listening to the podcast, I'm doing air quotes on natural because we know there's no such thing really. And long story short, using those strategies, I used like castor oil, and I used We actually did a Foley bulb at home, which I didn't know you could do that, but in Washington State midwives will do that. And then we used black and blue co-posh, which were two herbs that she was using to help induce me. And that led to a 4-day long labor, developing high blood pressure, actually needing to transfer to the hospital at that point. And I ended up with a C-section. So I think ended up being in labor for something like 90 something hours before I went to the hospital and got that C-section. I remember going to the hospital and just feeling like there were no other options at that point. Like they're not giving you other options. And that's the thing about, I think, informed consent at the hospital is it's like, we're going to give you our recommendation. And if you don't want to do that, that's fine. You don't have to take it, but we're not going to give you any other suggestions. You know?
Pretty much it.
That's pretty much it. So that's a short version of the birth with my first. Yeah. And then I found your group and I joined it.
Yes, you did. And I remember you coming to me and being like, I don't want to have another C-section again. And you were basically gathering information to see if it would be even possible for you to get pregnant again and to have that beautiful experience. And then you did.
Yeah. Yeah. And I pretty quickly, so they didn't tell me when I had my C-section and I didn't know anything about C-sections. They did not tell me that VBAC was even like a thing. Like I remember after the surgery and like, it was like such a blur, but I remember very clearly this OB being like, and you might be able to have a vaginal birth in the future. And I was like, what? Like, I didn't know. I don't think that they discussed that as like a risk, I guess risk. I don't know if it was a risk or like a side effect. I don't know, of a C-section. They didn't tell me that before they gave me my C-section. And so I was like, huh? Like, I didn't realize that. But I immediately went into it with the idea of like, I'm not going to have another C-section. So I was like, I think what I was scared of and what we chatted about, Carly, in your group was I knew I didn't want to have another C-section. I knew I wanted to plan a home birth, but I didn't know what would happen if I had to transfer to the hospital. And I didn't want to end up in another situation like I was with my first, where you transfer in and they're like, we see your history of C-section. We see you have type 1 diabetes. We see that, you're a home birth transfer. We don't know any of your medical history other than what we know. And because of that, we're only willing to do a C-section. And like, of course you can refuse. And like with my first, I was in the situation where like I could have refused, but I just didn't know what else to do. And no one was helping me. Like, I was just like, I feel really stuck. And my doula with my first was helpful in many ways, but she was also like a very medical minded doula. And I remember looking at her and being like, what else can I do? Like, can I try some different positions? Can I take a Benadryl? Because my cervix was swollen at that point. Can I I was like, can I do anything? And she was just like, no. Oh my God. So I just didn't want to get in another situation where I just felt totally stuck.
Mm-hmm.
Yeah.
That's one of the things is that I teach it quite often. It's like, you got to hire the right doula and had someone who is medical minded, because again, that's not being taught.
Yeah.
A lot of people don't know. It's like doulas are not one size fits all.
Totally. That's so true. And like the difference between my doula and my first birth and my doula and my second birth was like night and day. And I think it just goes to like your point that you're always talking about around like having the right birth team, right? Like that for my second birth, the one where I was successful, that was pretty much my only strategy, was like, get the right birth team. And everything else, like, I didn't really worry that much about, but I knew I wanted to have a VBAC. So with my second, I ended up getting pregnant a lot sooner than I meant to, but luckily for my mindset, I don't think my midwife would have cared actually, but luckily for my mindset, it was at that like 9-month mark so that I could have the 18 months birth to birth that doctors recommend. I probably would have done it anyway had I gotten pregnant sooner, but that was one thing that I didn't have to think about, which was good. Because, you wake up at when your child's 9 months and your uterus is healed. So
in theory, I mean, that's
yeah,
the thing. It's like, I feel if you feel you're good to go.
It's so arbitrary.
It is. It's completely arbitrary. I mean, I look at it as everybody is different. We all heal differently.
Yeah.
And if you feel you want to at least try, and then you choose to go the medical route after, and it's like, this is obviously not working, fine, that's great. But having these restrictions really limits our options, and then we feel we're pushed into
Yeah.
the corner.
Yes, totally. We're all so different. And I think it really should just be like how you feel, you know? Yeah. And I did feel ready. And we were going to start trying when Bowden turned 1, my son turned 1. But you know, it happened sooner than that. And like, that's kind of Jasper's personality. Like, he was just ready to be there. Despite like, we were even kind of trying to prevent, we were using the fertility awareness method. And like, I've gone over the math a bajillion times. There's really no way he should have been, but he was. So yeah, I found out I was pregnant with him, and I immediately texted my midwife, who I used with my first birth. And I was like, SOS, like, pretty sure I'm pregnant. And she literally, not one time did she ever put doubt into my mind. Like, she was immediately just like, okay, great. Like, let's do it. And did not get concurrent care this time with my second. And like, I really just disengaged from the allopathic model of care. Like, I was like, I do not want that. Like, I'm not interested in having a backup plan after I talked to you. At first I was like, I should have a backup plan. And I don't remember exactly what you said, but I could go back and look at your comment, but it was something like, listen, I know you can do this. We're here for you. Like, you know what's right for you. You know in your gut what needs to happen. And like, I believe in you. And that was really a turning point for me, because I was like, yeah, like I'm just going to see my midwife, and that care will always be there if I need it. You know, we're lucky to live in a world where hospital care is available when we need it, but I didn't. I was carrying a healthy pregnancy. So yeah.
Yeah. And I mean, I'm pretty sure that's something I said too.
Yeah.
I believe in you. That's
Yeah.
one of my things. It's like, I truly believed you could do it. And I
Mm-hmm.
knew, because you were such an action taker even before with your first pregnancy. You just made a few mistakes. And we all make those mistakes. I made them too. Where
Mm-hmm.
like you just didn't know what you were walking into. But
Yeah.
you had hired a midwife before. You had the sense to hire a doula. You knew what you wanted. Just
Yeah.
it's really hard to navigate that medical system.
It is. And it's really hard to like disentangle from it, because if you had asked me at the end of my first pregnancy if I was like scared, or if I thought that I was going to like need to be induced, or if I was like, I mean, I obviously did have it was fear-based decision making, wanting to go for that like quote unquote natural induction. But it's the turning point that I always go back to, where I'm like, oh man, like if I had just waited just a few more days, probably, like I was already 40 weeks. I ended up having him at, maybe it was 41 weeks, because I think I had both my kids at 41 and 2 and 41 and 3. So I had Bowden at 41 and 2, but I had started the induction like, you know, halfway through 40 weeks, because it was like a 5-day long process, 4 or 5 days long. So yeah, like had I just waited a few more days, he probably would have come on his own, and it probably would have been maybe a slightly longer, but like more similar labor to my second. Cause like my body knew what, like, was fine. My body knew what to do. My babies were fine. When Bowden was born, he was super healthy. Like he was like, didn't want to come out, but he was like super, super healthy. And actually during my entire labor with him, he never had issues with his heart rate. He never had issues with his like position in a major way. Like he was always head down. There was really no indication for a C-section other than some issues that were happening with my body. But that just like goes to show, like, I stressed my body out trying to induce myself, and he was just chilling, probably waiting another 3 or 4 days. Probably would have come at the same time anyway. You know, I just put myself through the ringer to try to get him to come, like, I don't know, 3 days earlier than he would have. It just makes me sick.
I just look at it as this. You had a journey, you needed to see, you had to have your eyes opened and what was going on so that you could then have this beautiful, empowering birth. So let's now talk about
Yes,
this beautiful, empowering birth that you had after that traumatic experience, your healing that you took on, and the fact that you did it.
totally. Yeah, I found out I was pregnant with Jasper, sent my midwife that text. She agreed to be my midwife again. I was so far from the fear mongering and stuff that had been happening during my first birth. Like, I had a really dreamy pregnancy, actually. And I even went so far as to kind of avoid like VBAC birth groups and stuff. Like, I would occasionally, like, I followed them and I was part of them, and I would occasionally like pop in and read some things or like search for something I had a question about, but like, I didn't want to even hear what other people's doctors were telling them. Like, I didn't want to hear about the calculator. I didn't want to hear about someone having to like fight so hard for their VBAC, because I didn't have to fight. Like I set myself up to not have to do that. And with your support, I was like, in my brain, just knew if I needed it, it was there. And if I didn't, I was good. And I was not going to put myself in a position where I was going to give myself like panic attacks over this birth when nothing was wrong. Like, my midwife would tell me, and actually my first birth gave me the confidence that my midwife could tell me if something was wrong. Like, I really trusted her. And she was really encouraging the whole way. Like, we did go over, it was her responsibility, of course, to discuss risk, but we would discuss it in more a way of like, I'm not worried, but like, these are the things that I would look for during labor. What do you think about that? Like, these are the kinds of things that could come up, but like, I'm not really worried about it. And like, her confidence gave me a lot of confidence. And so, even though I had a VBAC, there's not much to say about it being a VBAC because I didn't have to fight for it. I just put myself in a position where I was taken care of in like a really beautiful, holistic way.
Which is what we all deserve.
Absolutely. Yeah. Yeah, totally. I did see a chiropractor during my second pregnancy, which I think was amazing. I saw someone who was certified in the Webster technique. So she was really like really great with pregnancy, and she just kind of like knew what to do. I was just in to see her the other day, actually, and there was me and another mom, and both of us had babies about the same age. And she was like, the day after I saw Dr. Shea, I went into labor. And I was like, the day after I saw Dr. Shea, I went into labor.
There's a
So I
shout
did
out to
like,
Dr. Shea.
I know, Tree of Life Chiropractic in Seattle. She's amazing. She was very wonderful and like made me feel so taken care of. It. I was the other person kind of on my care team, but I didn't do pretty much anything else. Like, I drank a few cups of red raspberry leaf tea. I ate a couple dates, like not enough to make a difference, and I was intentionally not stressed about doing like all the things for VBAC. And I even like my doula sent me some spinning baby stuff to do. And I didn't even do that. Like, I was like, I just didn't want to stress myself out, And the other thing that I did during my second pregnancy that made it much more relaxing is I didn't know my due date. I didn't want to know my due date. I like had an idea of when-ish it was because my midwife gave me like a range. And I was like, well, obviously the range is 37 to 42 weeks. Like, that's the range she gave me. But I just kind of put my due date in my head as February 3rd, which was 42 weeks. And I didn't think about it again. Like, that's, if people asked, I said, sometime towards the end of January or early February. And like, I just didn't want to know. Like, I didn't want to think about it because I didn't want that pressure,
Yeah, I said April. It drove people crazy.
Yeah, totally. Yeah, I was saying February a lot, which was funny because February was like definitely the tail end, and people considered like it could be February 1st or February 14th. And I was like, no, it's probably going to be like, well, I thought it would probably be in January. It was like January 29th. So it was late. But yeah, I didn't want to be worried about that, and I didn't want anyone to be bugging me about it. So.
Well, I'm just so proud of you for knowing to do that too, because like that's one of the things I say all the time is like due dates. throw them out the window.
Mm-hmm.
Do a month after you're supposed to be.
Yes, totally, totally. And yeah, I took a VBAC specific birth class from someone named Sharon Musa, and I took I didn't, not your official class, but I went to one of your Saturday talks with Jenny, who had just had her VBAC. And other than that, didn't really take any special classes or anything. The week before I had Jasper, I went and got acupuncture, and I got a massage and went to my chiropractor. And I think I told you this before, but I love that quote from Yolanda Clark Norris that she says, like, people say whatever the last thing they did is what put them into labor. Like, it doesn't matter. It could have been like, I washed my pillowcases or I don't know, whatever. And it's like, that's what put me into labor. It's like, sure. Just because you were 41 weeks pregnant. Yeah, that's why you went into labor. But yeah, I went to sleep, snuggled my toddler. My husband had gone out to see a movie. And when I had my first, my water broke at like 9.5 centimeters. Jasper, my water broke at 1:30 in the morning. And I had, in retrospect, been having contractions, but like I didn't, I was ignoring them, like as you should. And I'd probably been kind of having a little bit of prodromal labor like the past few days, but it was very mild, like period cramps, like kind of bad period cramps, but nothing serious. So about 1:30, my water broke, and I went out to use the bathroom and saw, like, yeah, my water had definitely broken. My doula had given me some of those test strips, the pH test strips. So I tested it and I was like, yep, that's my water. And my husband was watching TV and I was like, baby, you better go to bed. Like, we're going to have a baby probably tomorrow. So he went to bed and I just slept and like woke up occasionally. And I think about 4 a.m., I started feeling like stronger. I was kind of having to breathe through them. And I got out of bed at about 4:30. And I had a to-do list that I was going to do mostly just to keep me occupied, because remember, my first labor was like 5 days long. And so I was like, I'm going to cook food for my birth team, and I'm going to do my nails, and I'm going to do my makeup, and I'm going to clean the house. Like, I had just a whole list of things. I had like movies to watch and all this stuff. But things like picked up like quite quickly after that initial, like, I have to get out of bed contraction. And I started making chili. I got out all the ingredients for my chili, and I like got out the can opener, and I was like, I'm just going to go put a load of laundry in, and then I'm going to come back upstairs and start the chili. And I put the laundry in, barely made it downstairs, got the laundry in, barely made it back up the stairs, had this contraction, and I was like on my hands and knees. And I was like, oh, I don't think I'm making chili. Like, I think I have to call my husband right now. So I called him and I was like, can you come out here? Like, I think I really need you. Then I threw up. Then he was like, we need to call the midwife. So we called her, and she came over like pretty quickly after that. This was about probably 6 in the morning, maybe 6:30. Graham's, my husband's parents, came and picked up our toddler Bowden because he was going to stay with them. I thought about having him stay with us, but he was just a little young. He's 19 months when Jasper was born. So, and in retrospect, I'm glad. By the time they came to pick him up, I was very much in like psychedelic labor land. And that's pretty much where I stayed. Like, I was not on this plane during my labor with Jasper. Like, I was very much like in a different dimension. My doula arrived, my midwife arrived, my midwife assistant arrived, and I don't think I was aware that they were there, really. And that also, I think, speaks to like how respectful they were and like how great they were about holding the space, because I wasn't not like, they would kind of come over and like put the Doppler on my belly and like check every now and then. And I was kind of aware of that. And I remember like at one point kind of almost like coming to when my midwife assistant took my blood pressure, and I was like, but I was not like, I remember like, oh, this must be Jane. Like, I heard about her. I like hadn't met her before or anything, but that's like how deep into Laborland I was. Like, I was in a different dimension. I was traveling to get my baby.
I love it. I love how
Yeah.
you described Laborland, psychedelic Laborland.
Yeah.
That's like my new favorite phrase now.
Those hormones were good.
They really are. They really are. I mean, people are
Yeah.
like, oh, well, you had the gas and air with your first. And like, yeah. And when I was at home, I had my own.
Yes, that is so true. And I think I really got to just experience that like hormonal rush and like the oxytocin and everything with Jasper. Like it was so different than with Bowden. Like going into labor naturally is like such a different experience than even using like the more like non-chemical labor induction methods. Like it was just so different. Like I was just kind of swept away. And yeah, it was really wonderful. I did get into my head a little bit when I started feeling pushy because with Bowden, I had started feeling pushy, but had a cervical lip. And so I was pushing on a lip for a while with Bowden, which was one of the concerns when I got to the hospital, is that like I couldn't stop pushing and it wasn't quite time to be pushing. Again, like knowing what I know now, I don't know that I don't know, but can't go back and change the past. With Jasper, I started feeling pushy and I was just like scared. Like I got into my head a little bit and I was like, I could have still like some cervix. Like this is where it went kind of wrong with Bowden, was when I started needing to push. And so my midwife, first time she ever even mentioned it, she was like, do you want me to check you? Because like it seems like you're kind of in your head, but you're feeling like you want to push. And she was like, I was on my bed, like with the birth ball on my bed. My husband was with me. And she was like, I think you're feeling pushy. And I was like, no, I don't think I'm ready to push. I'm not ready. She was like, okay, well, she goes, I think you should at least take your pants off because you're going to have a baby soon. I was like, okay. So I ended up, getting in the birth tub to just kind of like relieve some of the sensation I was having because it was just so intense at that point. And I was starting to get scared, starting to get in my head. And I just kind of needed that change. And she offered to check me and I said yes, because um, I was just scared to push. Like I just needed that little bit of reassurance. So she checked me and she was like, you have no cervix, like you're good to push. And I was like, there's no cervical lip. She's like, there's no cervical lip. I was like, are you sure? She's like, I'm sure. She's like, you have nothing in the way. Like push, go ahead. So I did. And I was having like pushing sensations that were involuntary, but I wouldn't say I had like the fetal ejection reflex. And I think like many people, like when I got to that point, I was just really ready to be done. This was about 10:30 in the morning. So it was like pretty quick from when I like got that really, really strong contraction, but it was still like, it had been it was a very intense labor. Like it was like, yeah, it was just really like trippy, intense, like strong sensations, strong waves. And I was ready. I was ready to push him out. So I did definitely like do a lot of active pushing. Um, I pushed for about 2 hours and I don't really know what I was thinking, but like I remember when I felt his head, I was like, okay, like, wow, this is actually happening. Like I I think there was still like a small part of me that had some doubt up until I literally could feel his head, coming out. And this is like the one scary moment of my labor, but I think that we can discuss this after because I think there's some interesting discussion to be had here, that he did get a little bit stuck when he was coming out. He's a big baby. He's 11 pounds. I'm 5'3", so I'm like not a big person. And he got a little bit stuck, but it ended up being fine. So my midwife had me get out of the water and I got out of the water and she had me like change positions a few times. And, she was able to like help me to get him out. And it was, a couple, probably 1 minute. He needed a little bit of help to breathe when he first came out, which she said happens in about 1 in 10 births. And that like sobered me up a little bit. But then, before I knew it, he was crying and on my chest. And we had that like beautiful moment in my living room where he was there and my husband was behind me and we just like had our little baby and thought that he was a boy, which was so funny because we were all so convinced he was going to be a girl that even while my midwife was like working on us, like helping him to wake up and stuff, she was calling him a she. And then we realized like finally like, oh, it's a boy, like, oh, it's Jasper. And we're so happy. So so wonderful just to be at home in our living room, and got into bed, had some soup that we pulled out of the freezer because luckily I'd prepped some food. And yeah, it was just like really a wonderful, beautiful experience that I would do again in a heartbeat. I would do it again. I would do it over and over. I loved my birth experience.
Oh, Claire, your story is just so freaking beautiful. And that's just it. It's like we deserve to love our birth experience.
Mm-hmm. Mm-hmm.
We deserve to
Yeah.
have
Yeah. Yeah. It was so wonderful. And I've done like so much thinking too about, his size and the fact that he had like a little bit of a dystocia. And, these are all the things that people are like, well, what if this happens? Well, what if that happens? And it's like, well, then you figure it out. Like, that's why personally for me, like the right decision was to have a skilled birth worker there, because that's why she's there. Like, midwives are so clinically skilled in physiological birth. And I remember asking her after, like, was that scary for you? Like, and she was like, no. She's like, that's like one of the most common kind of obstetrical emergencies. This is air quotes again, that you can have. And she's like, I wasn't really worried about him. Like, he was fine the whole time. He was fine. And his heart rate never had a problem or anything. What was really interesting to me is that, like, having talked to some nurses and stuff after, like some of my nurse friends and stuff, how differently that would have been handled in a hospital situation. So in a hospital situation, it probably would have been like a vacuum delivery or a forceps delivery. I had some tearing, but it probably would have been like much more significant. And had he had any issues with breathing at birth, they would have cut the cord immediately. They would have taken him to the warmer. They would have taken him to the NICU. And at home, he needed a little bit of help. And that was it. And he was on me the whole time. I was talking to him, rubbing his back. He had his umbilical cord attached. So my placenta was still attached. He like lost any oxygen or anything because he was still attached. So like just kind of thinking through the way that could have been managed in a hospital, and like how serious it could have been, and like how dangerous it could have been in a hospital, makes me just like so happy that having, a quote unquote emergency happened at home.
Yeah. I mean, that's just it too, is a lot of people like, well, what about this emergency? What about that? And then
Yeah.
like, yes, but if you're interrupting the physiological process, if you cut the cord, baby doesn't get their oxygenated blood.
Yeah.
So like, this is just one of the things that I just love about physiological birth. It's just how amazing our bodies really are, and how
Mm-hmm.
nature's designed this to be perfect.
Yeah.
And then
Yes, totally.
us being human and thinking brains, and men being in the medical field before and not even understanding. And
Mm-hmm.
what's happened is now everybody thinks, oh, that's an emergency that immediately needs this intervention and this intervention and this one. And it's like,
Mm-hmm.
I have no idea.
Yeah, totally. Yeah. And I think this also just goes back to hiring the right team, right? Because my midwife was like, she was really experienced and she knew what to do, but she also, like didn't do anything she didn't have to do. Like she just took it step by step, and she held such beautiful space for me. Like she was not invasive at all. And I remember this with my first birth too. Like she just was there. And that's the way she was like throughout pregnancy too. Like she's there if I have questions, but she's like happy to let me have as wild of a pregnancy as I want, And I really appreciate that about her. I think she has a way of giving her patients back responsibility for themselves. And I kind of like considered that more this pregnancy. Like I think my first, I was almost like surprised. Like I was like, she doesn't schedule appointments. She doesn't do this. And it's because she's really leaving it up to her patients to do that. And I think that's like a really hard to find thing in a midwife or provider, someone who's just willing to let you be in charge of your own pregnancy, and do what you think you need to do when you need to do it.
Yes. And can we just speak to one thing though, because she normally wasn't going to take on type 1
Yes.
diabetes, and she did.
Mm-hmm.
And now, because she's experienced this beautiful home birth as you being her client, she is now accepting more type 1 diabetics. So you really change
Mm-hmm.
things for other moms that are in your situation. So let's just speak
Yeah.
into that for a
Yeah.
minute.
Yes, totally. So when I reached out to her with my first, she had never had a client with type 1. And I think things vary state to state, but like certainly in Washington state, like it's considered a high risk pregnancy. And most birth workers, if you talk to them and you say anything about diabetes, if it's not diet controlled gestational diabetes, they will not take it, take you as a client. And I ended up finding those two midwives, my midwife, and then the other one, also in Washington, she had worked with Amish populations. So she hadn't worked with someone with type 1, but she'd worked with a lot more like people who would be considered high risk because they don't get traditional medical care in that community. So she had that experience, which I thought was really interesting. My midwife is she's just a cool person. So like when I talked to her the first time, I don't know that anyone had even really asked her. Like, I don't know that anyone had asked her before, because she was kind of like, I remember we were on a Zoom call and I was like, well, right up front, I want to tell you because I want to know if it, excludes me from your care. Like, I have type 1 diabetes. It's really well controlled, blah, blah, blah. She was like, yeah, okay. She goes, I think we could do this. Like, I just remember that. I remember her saying that. And I remember just being like, oh my gosh, like she believes in me, like this could happen. And so I was her first client, and it might have just been because I was the first person that asked. But after I had my first, even though I had ended up with C-section, she took another client from my type 1 diabetes Facebook group that I had referred to her, in Washington. So this woman actually ended up having her baby before I did my second. So she had her baby, and then I had my baby, and now I think she has another, or had another type 1 diabetes client. So now there's someone, yeah, like you said, that we can refer to. And so I also think that now, because the other midwife, Shannon was her name. The other one that I found, because I said I had found two, she was the birth assistant at my first birth. So now both of them have seen a birth with type 1 diabetes, even though my first one, I ended up in C-section, but not because of diabetes. And now I believe both of them would take type 1 diabetic clients. So you're right. And I love that. I love that piece of the story, that now there is an option for women with type 1 diabetes in Washington. Two options.
I know that's the ripple effect. That's what I love the best about just being out there, putting that information out there, asking the questions, going for what you really want, because it trains others to then see it as, oh, I could do this. Some people are going to watch this or listen to it later if they're just on the podcast, and they're going to hear it's like, I have type 1 diabetes and I could have a natural birth. I could have a
Yeah.
Whereas before, we don't know that these stories exist.
Yeah, totally. And I think it's just like, again, like finding the right person. And we had a spreadsheet. I think we talked to almost every midwife in Washington state. Like, we literally I made a list of every single midwife, every single birth center I could find. And we just called and called and called and called. And I got it down to like a spiel, because I had talked to so many of them, and I did want to tell them up front, because I didn't want to waste our time. And so like immediately I would just be like, I have type 1 diabetes, like give them kind of the rundown of my like health history, and are you willing to take me on as a client? And every single one, time after time, no, sorry, we don't take clients with type 1. I got some referrals to like, oh, why don't you try this OB? She's like more naturally minded, or like this or that. And so they were like all very kind, but you have to be willing, I think, to go through a lot of rejection if you're committed to finding the right birth team. Like, you shouldn't want someone, first of all, that doesn't want to work with you, but also you just have to keep asking, because there are a lot of OBs and midwives out there, and there's going to be somebody that will align with what you want, and I think that was a big lesson for me.
And it's true in all aspects of life. You've got to be willing to take rejection. Not just like in birth, but I mean, how many times did certain authors present their books and get rejected? Or
Mhm.
actors and actresses, they did the same thing. They put themselves out there and they got rejected. Or you have a partner. It's like, I didn't find the one this time, but that's okay. You just keep
Yeah.
trying. And eventually it just signals like, okay, you're really serious
Yeah.
about it. You really want this. Here it is.
Totally, totally. And with Emily, our midwife, like not only did she say like, yeah, I'm willing to take you on, but like the vibe was just right, you know? Like she's just like somebody that I could be friends with, to be honest with you. Like she's just so warm and like very like as I said, she's just like so chill. Like she's just so like relaxed about everything and so knowledgeable. And so like we just knew with her, that's how we picked her versus the other midwife, is like we were like, she just feels like she feels like she could be like part of the family. And now she is kind of like part of the family, you know, like we like call her for everything still. Like I'll be like,
Aw.
Jasper has a cough. Like, what do I do? Because she's such a great herbalist and she knows like everything to do. Um, and yeah, we just I think we'll stay in touch with her for forever. And if we have another baby, she'll be our midwife again. Like she's just so wonderful. And that also is, you know, our doula this time. The first time I was very much into picking like the most qualified doula. And I picked a doula that had a lot of qualifications and a lot of experience and was well known in the city and was not the right doula for us. Like she just wasn't. This time I literally just went off vibes alone. Like I was like, I just want someone that makes me feel comfortable, that I feel like I could be naked in front of, and like that I feel like I would be comfortable like letting hold my baby. And that's how we picked her. And she was amazing, so wonderful. Actually, a relatively new doula and not super well known in the city. Like my midwife hadn't heard of her. And we couldn't have picked a better person for us because she was just so comforting and very knowledgeable, very good at what she did. I don't know what she did during my birth because I was so I was so out of it, but Graham said she was great with him too. And then after the birth, I just remember like her like just kind of sitting and like chatting with me. And I just had this like really beautiful conversation with her where it was actually the first home birth she'd ever witnessed. She had never seen a successful home birth before. She'd only been at transfers. And so it was just like this really beautiful conversation around like home birth and like what it was like for her and what it was like for me, and how cute the baby was, and just, you know, all that stuff. Yeah.
It's just so beautiful. So we're wrapping up on time.
Yeah.
So is there anything you would want to tell new moms or moms who have had previous traumatic experiences and want to try again? What would be your one tip to tell them?
I mean, not to belabor the point, labor, haha, but get the right birth team. Like keep interviewing people, keep talking to people until you find someone that makes you feel comfortable and that is willing to treat you like if you're high risk, like just a normal, healthy birth and pregnancy. And just know that you are not high risk until you're high risk. You know, like you're not a label. You are having a normal, healthy pregnancy until you're not. And when you're not, that medical care will always be there.
Oh, that is quotable right there. So I'm just going to do a little teaser now, because the fact is that even though Claire has had this amazing, beautiful, empowering birth experience, there's another facet to her personality and what she does for parents. So Claire, do you just want to speak quickly to what you help parents with and where they can find more about you? And of course, we will be bringing Claire on again in this, what she'll be teaching on this in the future. But just a little teaser.
Yeah, totally. Thank you so much. So I own a company called Shine Space Parenting. You can find the website is shinespaceparenting.com. And I work with parents specifically who think there might be a little bit more going on with their children's behavior, but not, but they maybe don't have like a diagnosis yet, or maybe they're waiting for a diagnosis of something. So I work with families who have kids that struggle to attend birthday parties and gymnastics classes, and who's just like their daily lives are really like disrupted by their child's behavior. So I have about 10 years of experience in the field of early childhood behavior. And I just love working with those families to help them kind of find some some stability in their day to day and make them feel like they have the tools to support their children in like a really loving, holistic way, like not the traditional kind of like reinforce or punishment framework.
Yeah, the reinforcing punishment framework doesn't work for my kids.
Yes. And for so many families. And also it just like feels like contrived and kind of yucky. So I love to work with families in kind of like a more holistic way.
I love it. And I
Yeah.
cannot wait for that interview when we do that because this is just something that parents, we really need it.
Mm-hmm.
We've been taught punishment and reward and all of the psychology, all of the developmental psychology, it all says the same thing. It doesn't work. It's a
Mm-hmm.
short-term solution for a long-term issue that you really want your children to feel empowered so that they don't go into their adulthood thinking that there's something wrong with them when they're trying to ask for what they want, especially if you have a daughter,
Yeah.
that we don't feel like we're being punished if we don't do what we're told.
Yes, absolutely. Absolutely. I think there are ways to kind of build in structures like into your daily life to support your children's behavior without doing things like sticker charts or like clip charts or timeouts. Like nobody wants to do that stuff. It doesn't feel good. And it's a lot of hard work too. And it feels much more natural if you can just kind of build strategies into your day-to-day life that support your child.
Yeah. Well, I
Yeah.
have a feeling we're going to have a really good conversation when we get into that topic because
Yeah.
there's just so much experience that I've had even dealing with my kids. I mean, yours are still kind of young, but watching Hunter and Michaela grow up and seeing the structures that I've put in place, I don't do reward charts. I don't even do timeouts.
Hmm.
First of all, if I tried to do timeouts, my kids would be like, I'd be constantly trying to get them back on the chair.
Totally.
Like, what happens if I get off the chair?
Yeah.
Are you going to sit here while I'm on the chair? And if you're going to sit here, I am going to be so loud that you're going to want to walk away. And as soon as you walk away, I'm getting up. Like
Hmm.
that's my kids' energy. So yeah, no, Claire, this has been amazing. Thank you so much for sharing your birth story. I know it's going to inspire so many moms. And for if you're out there in the audience and you really want to connect with Claire, just reach out to me and I'll connect you both, okay?
Yes, please do. I'd love to talk.
Yes. All right. Thank you so much, Claire.